Hey guys, this is Dr. Hub. Today we are going to look at the vaginal infections. So under the vaginal infection, we are going to see three diseases, and to begin with, we are starting with the bacterial vaginosis. So what is meant by the bacterial vaginosis? First we have to look at the causative organisms. So under the causative organisms, it includes the altered vaginal flora. So it has the altered vaginal flora, and there is an increased concentration. There is increased concentration of the Gardnerella vaginosis. Gardnerella vaginalis. So what is the etiology here? The etiology is nothing but there is an increased vaginal pH. There is an increased vaginal pH. So then comes the question about the sexual transmission. So is it sexually transmitted? The answer is no. The bacterial vaginosis is not sexually transmitted. Next, we move on to the discharge. So how is the discharge? The discharge in bacterial vaginosis is fishy. The discharge is fishy and it is thin as well as it is yellow. So what are the symptoms of the bacterial vaginosis? The symptoms is that there is a fishy odor. There is a fishy odor. Next, there is no itching which is seen. So what about the pH in this case? The pH is greater than 4.5. What about the speculum? The speculum, there is no vaginal epithelial inflammation. There is no vaginal epithelial inflammation. Next comes the question on the KOH. So if you look at KOH, it is a positive whiff test. It is a positive whiff test. Then when we look at the wet mount, there is a wet mount. So under the wet mount, there are clue cells. The presence of clue cells, and there is no WBC is seen. Now comes the question of the treatment of the bacterial vaginosis. So the treatment is that there is a metronidazole as a treatment. So there is metronidazole, as well as we can give the clindamycin. Next comes the Trichomonas vaginalis. So we are going to look at the Trichomonas vaginalis. So under the Trichomonas vaginalis, the causative organism is the vaginitis. Vaginitis. So the disorder is caused by the organism Trichomonas vaginalis. So the etiology is it is sexually transmitted. So etiology is it is sexually transmitted. And what about the discharge? The discharge, if you see, it is the frothy green. The discharge is frothy and it is green. So what are the symptoms of this? The symptom is that it is itchy and burning. It is itchy as well as it can be burning. Then comes a question on the pH. So how is the pH? The pH is greater than 4.5. Then what about the speculum? The speculum is a strawberry cervix. It is a strawberry cervix. Then we move on to the potassium hydroxide. So in case of the KOH. So in terms of the KOH, the whiff test can be positive. So the whiff test, if you see, there is a whiff test and it may be positive. And what about the wet mount? So there is also something known as the wet mount. So this wet mount, it is motile. Wet mount is motile. It is trichomonads. Trichomonads. And also the WBC is seen. Then we move on to the treatment of the trichomonas vaginalis. So vaginitis. So here there is metronidazole, as well as it is to treat the partner also. So you treat the partner. Next we move on to the candidal vaginitis. So what is the candidal vaginitis? So here the organism which causes it is nothing but the Candida albicans. So Candida albicans is the organism which is causing the candidal vaginitis. And what about the etiology? The etiology is that it is decrease in the immunity. There is decrease in the immunity. Then comes the question on whether it is sexually transmitted. The answer is no, it is not sexually transmitted. Then what about the discharge in case of candidal vaginitis? So the discharge is easy because it is candidal vaginitis, C for curdy discharge. So there is curdy discharge. And it is white. So what about the symptoms here? The symptoms is that there is itching and burning. So there is itching as well as burning. Then pH. What about the pH in case of the candidal vaginitis? The pH is less than 4.5. What is the speculum findings? The speculum is inflamed epithelium. There is a inflamed epithelium. Next we move on to the KOH. So in terms of KOH, there is a pseudo hyphae that is seen. So there is a pseudo hyphae that is seen. Then comes a question on what is the finding in case of the wet mount. In case of the wet mount. So in case of the wet mount, what is seen is the WBC. The WBC is seen. And how do you treat this case? So the treating a case of candidal vaginitis, there is oral. It can be oral. It may be the vaginal azole. There can be a vaginal azole, as well as there is no need to treat the partner. So no need to treat the partner. So this was about the vaginal infections. We saw the bacterial vaginosis, we saw the trichomonas vaginitis, as well as the candidal vaginitis. To learn and grow daily like this, please do subscribe.